Good afternoon. It's Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Wanted to provide a bit of an update in our current epidemiology. Manitoba, we're continuing to see a significant amount of spread of COVID-19 in the community. And of course, as we discussed in the past, the numbers we're able to report are a significant underestimate of the amount of test positives occurring each day. What we're reporting is including those PCR tests and then a fraction of the rapid tests. So we also look at other indicators, hospital and ICU information. And so at this point, we do see that hospitalization rates are high, although stable. And the same goes with ICU admissions at this point. Like other jurisdictions, we have been receiving reports from the National Microbiology Lab focused on wastewater monitoring. That provides an indicator to COVID levels in the population. Well, this information, like any data we receive, we don't use it in isolation. There are studies that have shown this wastewater data to be a good early indicator to identify new strains, but also showing increasing or decreasing volumes of transmission. The data for Manitoba, which is focused only on Winnipeg, did signal early on that there was a potential peak in early January. However, since then, we haven't seen a dramatic decline and seen quite variable levels since that time. So we do have to keep a close eye on that information. And again, that's only one piece of the information that we're looking. So it's still early to describe where definitively we are in this wave. We do know for sure that the virus is very much present in our communities and circulating. And so that means it's still important for everyone to do what they can to protect themselves and the people around them from Omicron. Most importantly, that is getting vaccinated with the dose that you are immediately eligible for as soon as possible. It's still the best way to protect ourselves and the people around us. We all need to monitor very closely for symptoms. Very, very mild symptoms should have us isolating, certainly seeking testing at the earliest opportunity if you're at higher risk, because we do have treatment options available. But everyone needs to be monitoring for symptoms and taking action should even mild symptoms develop. Of course, those who have symptoms or who test positive should be notifying their contacts so that they can be extra diligent with monitoring for their symptoms. But we continue to see quite a significant benefit to being vaccinated, especially that after that third dose, even with Omicron, it provides a significant benefit against severe outcome, that being hospitalization, ICU admission, and death. So again, all these measures help us protect ourselves and the people around us. Last week, we were updating Manitobans about the approval of Paxlovid, an oral antiviral used to treat COVID-19. We have received a shipment of 1,100 treatment doses. The eligibility for this is similar to that of the monoclonal antibody treatment. And the website is updated with all this information. But again, the main point here is that this is not a substitution for vaccination. It's not a substitution for following all the fundamentals. But those that are at higher risk, this is another tool available to prevent those severe outcomes. The important thing here is that treatment has to be started very early. So treatment has to be started within 5 days of symptom onset. So this means very close observation of symptoms, early testing, and then access to treatment is what will decrease that likelihood of severe outcomes for higher risk individuals. So please, if you are experiencing symptoms and you're in those higher risk categories, do get tested right away and receive treatment as soon as possible. So in response to Omicron, we've already changed our testing processes and case and contact management for schools and in the community. We're now going to be putting similar changes in place for the early learning and the childcare centers. And this will come into effect this Friday. Because Omicron, we know, is so transmissible, childcare centers will no longer be required to follow up with public health on all cases or identify close contacts. Staff, family, home childcare providers should continue to monitor daily for symptoms before attending either a childcare center, or a home-based childcare facility. Children or staff exposed to COVID-19 in the childcare and school setting may continue to attend childcare and school if they remain asymptomatic, but again, very close monitoring for symptoms. Childcare centers will monitor absenteeism and numbers of positive test results reported by staff and families. If there's a significant increase in COVID-19 in a cohort, they can connect with local public health offices for additional guidance. Public health will continue to monitor the overall number of cases confirmed by PCR testing or other lab-based tests in childcare centers, and we may contact the facility if we see more COVID in the center beyond what is occurring in the community. Additionally, childcare centers will no longer be required to identify close contacts, and it's no longer recommended that they distribute notifications for individual cases. Licensed childcare home providers should follow the same guidance for notifying contacts that applies to all other Manitobans. We're recommending that centers regularly communicate with families about absenteeism and a number of cases in the past 14 days connected to their facility. More information is going to licensed childcare facilities today, and further details about the changes being put in place. As most of you already know, today is Bell Let's Talk Day. As we all have come to know, the pandemic is not just affecting our physical health, it's having a profound effect on mental health as well. And so we all should ensure we are paying attention to our own mental health, and should reach out to family and friends who may need to support, may need our support. Today is a good reminder to talk about that. So the pandemic has affected us all in many different ways. I know for myself, I've had to lean on family and friends during many difficult times. I've reached out to many friends and family members to ensure they are doing well, and I encourage all Manitobans to consider doing the same. There are resources online at manitoba.ca/COVID-19 that might be helpful to yourself or someone you care about. So remember to be kind to yourself and to others during these very difficult times. So thank you. I'm going to pass it over to Dr. Reimer.
Thank you, Dr. Roussin. Good afternoon. I'm Dr. Joss Reimer, the medical lead for Manitoba's Vaccine Implementation Task Force. So it's been quite cold lately, and when the weather is like this, our thoughts often focus on the people in our communities who may not have a stable place to call home. We recognized in earlier iterations of the campaign how important it was to reach out to individuals who don't have reliable housing with trusted partners to reduce barriers and ensure that they feel comfortable and have access to the vaccine. Many people who are living in shelters now are eligible for their third dose. And so that's why we have vaccination teams who are meeting people where they're at. So in Winnipeg, this has meant visits to a few shelters in December to give third dose boosters, along with a partnership between some community organizations and the urban Indigenous sites to support any ongoing needs. The approach varied in other regions based on how they could best meet the needs of these folks in other communities. But it did include vaccines being brought to shelters wherever possible, vaccine clinics at some local food banks, near alternative isolation sites, and the vaccine being offered through trusted community organizations or other sites that work with vulnerable people, offering transportation to existing clinics. In Southern Health, for example, shelters and other community organizations supported their clients by helping to coordinate transportation to vaccine sites. The shelter-based vaccine program is just one example of the many ways that we are continuously working to ensure accessibility for Manitobans. We want everyone in the province to have the opportunity to receive timely and convenient protection from the virus. It's hard to get an exact tally of how many doses were given because of these outreach efforts, because they varied so much from community to community. But we do know that every dose is important, especially for people who are experiencing homelessness, and especially now to help prevent severe outcomes from Omicron. People who are experiencing housing insecurity often have multiple health conditions that put them in a position where it's not only more likely that they could contract the virus, but more likely that they could become seriously ill. So I wanted to take a moment today to thank the teams in all parts of the province that have done this great work to reach out to this sector and make sure that people who are experiencing homelessness still have access. I would also today like to provide a quick update on the vaccine program that's well underway in our schools. So nearly 60 in-school clinics are scheduled for this week, plus more than a dozen after-school clinics. Over 15,000 doses have been given through our school-based clinics so far, and that's from September to January. Nearly 9,700 of these doses have been given to kids aged 5 to 11. Because the school clinics are accessible and close to people's homes, adults have been visiting the after-school clinics as well. In fact, nearly 4,300 people over the age of 18 have received a dose at a school. So if you are a parent or a guardian who has not yet taken your child to be vaccinated or to get their second dose, please do so as soon as possible and as soon as they're eligible for that second dose. If there's an upcoming vaccine clinic in your child's school, I would encourage you to take advantage of that opportunity. Currently, children in the 5 to 11 age group are lagging a bit behind in their uptake of the vaccine so far, and are only beginning to get their second doses. So we need to get the numbers higher in this group. We really want to protect all of the children in Manitoba. So just as a reminder, your child is eligible to receive their second dose 8 weeks after the first dose, unless they live in a First Nations community, in which case it's 3 weeks after the first dose. Overwhelmingly, the research and real-time scientific evidence has demonstrated the safety and effectiveness of the pediatric vaccine. In fact, just this week, the National Advisory Committee on Immunization strengthened their recommendations for the vaccine in the 5 to 11 age group. So based on the safety and effectiveness reports that have been produced both before and after the rollout began, NACI now strongly recommends this 2-dose series for the 5 to 11 age group. Moving on to older youth, as you know, we have been closely following the National Advisory Committee on Immunizations recommendations throughout the pandemic, and we've been waiting on word about a recommendation for a third dose or booster dose for people aged 12 to 17. This has not happened yet. We do want to recognize today, though, that it is possible that NACI will not recommend a third dose for this age group. So I wanted to talk about that for a second. NACI would only recommend a third dose if it was deemed clinically justified. And by that, I mean that there's a benefit to young people in having a third dose. This means that they need to do an analysis of whether or not this younger group may get sufficient protection against COVID from their first 2 doses, because they're younger, because they have fewer risks for severe outcomes, and generally speaking, a stronger immune response. I know last week I discussed concerns that we have regarding long COVID, and I wanted to provide some reassurance to parents that most of the concerning data so far around the world regarding long COVID refers to risks for adults. Overall, it appears that children have a lower risk of long COVID compared to adults, but we still have a lot to learn about long COVID, and we need to continue watching the data as it's developed. So I will keep you informed as I know more, but regardless of what NACI says for third dose recommendations for teens, I do want to reinforce the importance of them getting their first and second dose when they're eligible. as we're seeing more people in the province with COVID, I also wanted to provide a brief reminder about when to get your next vaccine after you've tested positive. Even if you've recently had COVID, it's still important for you to get your next dose of vaccine once you're no longer isolating and no longer have symptoms. While a COVID infection is expected to provide some immunity, we have much better data showing that the vaccine provides better and longer lasting protection. We know that being fully vaccinated, and for many people, getting your booster will help protect you from more severe outcomes if you happen to be infected again. So it's really important that you give yourself the best chance of being protected against this virus. And finally, to add to what Dr. Roussin said on Bell Let's Talk Day, I am so grateful that Manitobans are again being encouraged to open up about mental health, to support one another, to normalize these important conversations. Mental health is health. The brain is a vital part of the body, and to function well, it needs rest from stress. We need adequate sleep. We need food, empathy, compassion, help from others. We need so many things to be healthy, including our mental health. This pandemic has clearly harmed our collective health, and we've all experienced a lot of stress and a lot of mental strain related to the pandemic. I know I have, I know Dr. Roussin has, and I know that most, if not all of you have as well. So, I want to encourage everyone to support each other, to try to find ways to recover, to refresh, to do everything that you can to support other people, to be kind and gentle with others, but also to be kind and gentle with yourself. We know that Manitoba has some mental wellness supports. Dr. Roussin mentioned the website already. So I really do ask that if you are struggling right now, that you reach out. Often when you're struggling, reaching out feels like the hardest thing in the world to do, but we still want you to use the resources we have available or reach out to friends and family or someone else who's trusted in your life. And if you're someone who is worried about someone else, reach out to them. Make sure that they're doing okay and offer to be a support to anyone in your life who may be struggling. So with that, we will take questions.
Thank you, doctors. A reminder to our reporters on this Zoom session, you will have one preliminary and one follow-up question. Up first this afternoon from CTV Winnipeg, Michelle.
Hi, Dr. Roussin. I wanted to ask you a little bit about some polling that shows about half of people who think if they caught the Omicron virus, they would have a serious but a manageable symptoms, while a third of people think their infection would be mild. What do you say to people who aren't necessarily as worried about Omicron right now?
Well, we certainly see that there's a change with this variant on that level of severity. But it's still something that we all need to take quite serious, especially those that are at significant risk. So we still know vaccine is our best protection against severe outcome. So that's probably the biggest recommendation I would have to all these people who are taking this poll, is to ensure you are up to date on all the eligible vaccines. Otherwise, many people will have mild symptoms. But many people still have severe symptoms. We still have many Manitobas in hospital. We have many in ICU, and unfortunately, you see the list of Manitobans that we announce every day that have died related to COVID-19. So it's still a virus that we need to be very alert to and take as many steps as possible to protect ourselves and the people around us from this.
Is the province giving any consideration to loosening measures for large gatherings or lifting capacity limits for theaters, concert halls, or entertainment venues? We know that the current orders are going to expire in a few days here.
Yeah, so we'll have a pending announcement on our next steps. Certainly all these measures are always considered continually on what we need to do to best protect the overall health of Manitobans. And so there'll be more to come on the restrictions in the coming days.
From CHVN, Taylor.
Hi. On that note, obviously the orders do expire quite soon. What kind of things should Manitobans be expecting?
Yeah, so at this point, I think you expect some further information on that. Once we have a definitive decision, we'll make that announcement. So right now, Manitobans can expect to hear in the near future what our plans are.
Should Manitobans be planning on making changes to gatherings, or if they're business owners, should they be wondering what's going on next week?
Yeah, we're going to have more to offer on that in the near future. And so, just like any iteration of these orders, we always want to ensure we're providing notice to Manitobans, and so should be expecting some more information shortly.
From the Winnipeg Free Press, Katie.
Good afternoon. I have some questions for Dr. Roussin. Why isn't the wastewater data being released in Manitoba?
Yeah, so that is something that's being worked on. It was just the nature of the how we're receiving this data that Winnipeg's just wasn't being published as part of like many other cities are. So we're working with the Public Health Agency of Canada to be able to get that published as well.
Okay, and will the province reopen PCR testing to the public? We're seeing only around 2,000 tests conducted a day now. So why not expand eligibility?
So what we really need to do is start moving towards our long-term measures with COVID. So what's really important is we want people who to test who are at first eligible for treatment. So that's really where we want testing to lead to. So a test and treat process to this. We're still testing, so we can still do sequencing and find new variants and things. So that's why we still have access to this testing. But for the most part, we really want people who are at high risk, who are going to possibly be eligible for treatment, to have access to quick testing, so we can get that treatment in their hands.
From Global News, Rosanna.
As you mentioned, Dr. Roussin, we have some information from wastewater testing, but since PCR testing is very limited at the moment, a lot of people are still feeling they don't know how big the risk of COVID is, especially I'm thinking some people who are isolating because they're just at risk of more severe outcomes, even though they're vaccinated. So can you give us a sense of where we are on the curve and your reasoning behind that?
Yeah, and so we look at a number of things, our test positivity, the trend in the PCR, wastewater, hospitalizations, all of these things. So it's really difficult to give a definitive course on that. If we look at where other jurisdictions are and the timing of that and put a lot of these pieces together, it looks like it is possible we're nearing a peak or a plateau in Manitoba. It's very difficult to pinpoint those type of things, but looking at all of our data, that's what's leading us to think that we're nearing that peak in the coming week or so.
Thank you. Dr. Reimer, about 6 months ago, around 70% of Manitobans had received 2 doses of the vaccine. So why do you think third dose uptake is lagging so far behind? I think right now we're at 39%.
Yeah, I think it's challenging to evaluate the risk for individuals. So, we really want people who are over the age of 50 or those people who have health conditions that put them at higher risk to get that booster. And a lot of Manitobans don't necessarily see themselves as at higher risk, but even something like diabetes puts you at higher risk. Most people over 50 will have a health condition that adds to the risk on top of just the age base alone. And even those who are under 50, many of us have health conditions that put us at higher risk. So, I do ask Manitobans to think about, what medications do you take? What do you see a doctor for? And if you're taking a medication, it means you have a health condition that might be putting you at higher risk and means that you could end up in the hospital if you were infected, even if you've received 2 doses. So, if it's been more than 5 months for those people over 50 or more than 6 months for others, and you have any sort of condition, including age, that puts you at that higher risk, now is the time to go. We want you to be protected. We want you to stay out of the hospital, and we want to protect the hospital resources as well, so that whenever any of us need them for COVID or anything else, that those beds are available.
From the Brandon Sun, Karen.
Good afternoon. Just getting back to the wastewater, even though the data hasn't not being released to the public, I'm assuming you've seen it. So when you say that we're declining, but not enough to say that if we're past a peak, what kind of metrics do you have to say that, yes, we are having a significant decline and we're going to end up at a certain rate at a certain time?
Well, so that's a variety of indicators that we look at. So we certainly don't have, any indicators that are clearly telling us that we're in a decline right now. We talked about the wastewater, and that indicated that there was a peak in early January, but since then we haven't seen a dramatic decline, more of a plateau, but a lot of variability in those numbers. So we always have to be cautious in our interpretation of that. But we'll be looking at, most notably the hospital and ICU admissions, as well as some other indicators. We still use test positivity. There are certain sectors such as healthcare, which do frequent testing, so we can follow some trends on. We'll be following all these indicators, and like I say, when we have a more definitive answer from those indicators, then we'll provide that.
Okay, thanks for that. And this is more of a question for Dr. Reimer, just saying about the trying to get a third dose and saying that that might not happen for teenagers. But just in your opinion as a doctor, would you like to see a third dose be offered to these young people?
Yeah, and to be clear, I haven't seen any report from NACI one way or the other about whether or not they're going to be recommending booster doses for teenagers. Just wanted Manitobans to recognize that they may not recommend it. It's their job to look at the evidence really carefully to determine what's the most beneficial option for everybody in Canada. So, I don't have any particular wish one way or the other. What I want is for that scientific evaluation to occur so that we can provide Manitobans with the best possible information and advice about what we know about the risks and benefits of the vaccine, whether it's a booster dose or any other dose. So I'm really looking forward to hearing from NACI about what their evaluation found, and we'll be sharing that with Manitobans as soon as it is provided to us.
From CJOB, Skylar.
Hi there, guys. Thanks for taking our questions. Just to follow up to Rosanna's second question and then the answers to that you provided. Either of you feel free to take this one. I know you're not in the hospital setting day in and day out like some of the folks we do have access to, but I did want to get your opinion on how what we're seeing in hospitals right now compares to, say a bad flu season. I just find that a lot of folks are, seeing these numbers, now over 700 COVID-related hospitalizations, and it, without the context, it's just kind of a large number to a lot of people.
Yeah, so I can try to address that. So it is right as we start to transition our response to Omicron, which Omicron has really forced our hand to change the way we deal with COVID. We have to look at the strains on healthcare systems. There's no doubt that there's a significant strain on healthcare system at this point. We do know we report overall COVID numbers in hospital, and we're going to be working on trying to provide the breakdown of those with COVID infection that are there due to COVID infection rather than happen to be there for another reason and happen to test positive for COVID. So we're working on trying to provide that further update. And then, of course, there'll be a significant proportion of those individuals that are admitted due to COVID, because we do know there's still a significant strain. But then in other years, there's a significant number of people admitted to hospital also with the respiratory viruses such as influenza, RSV, that we just haven't seen high numbers in this season or last season. So it all has to be taken into context. I mean, I think that overall it's clear that the healthcare system has been under strain. That relates to staffing issues as well because of the widespread transmission of Omicron. So we're going to try to be providing a clear numbers on the actual COVID related admissions. But for now, it's clear we still have that strain in the system.
Thank you for that. And then just to expand on that a little bit, I've been looking at the new inpatient admissions on the GeoPortal site, and they average probably in the last week around the 40-50 mark, and folks within the health industry say the turnover rate does take quite a toll on resources, because switching out beds is a little more difficult than keeping the same person in a bed. So is this turnover rate similar to what you would see in a so-called regular respiratory virus season, or is this a bit higher?
Yeah, that's tough for me to answer on that or have all that information. I think what we do know is that with Omicron, we're seeing the length of stay on average being shorter than Delta and then previous variants. So we are seeing that shorter length of stay, which could explain some of this higher turnover.
From the Winnipeg Sun, Ryan.
Hi, appreciate the time. We've seen in Quebec restrictions on big box stores for requiring a vaccine and for cannabis and liquor stores. Is that something Manitoba would be at all considering in the future?
So we've, like I say, we continually review our restrictions and which way we need to go with them and consider all sort of various options. At this point, those are not something that is on the table. But like I say, things change, and we'll be following things closely, and we'll have to adjust depending on what we see in the community.
Okay, and I know this may be tough to answer, but with so many cases in Manitoba, how many are we seeing that are reinfections? Is that common, or are we seeing everyone kind of get new COVID, I suppose?
So I don't have a definitive answer for that. It is very difficult right now, given the amount of rapid tests that are occurring that are not reported. What we'll say is from what we do know and from other jurisdictions, that's a very low number of reinfections.
From CBC Radio Canada, Julien.
Good afternoon. I just want to go back to some point that because my connection broke up. Did you say that you will stop following the cases in daycares like you did in schools? If so, why and when this is starting?
It is starting this Friday, and we're going to have the similar case and contact management, or the same case and contact management as we had in schools. So not necessarily responding to single cases with various case investigations. And again, the change is made from Omicron. It's so much more infectious, has such a shorter incubation period that case and contact management is just not effective. So we have to change our approach to it.
We talk about mental health and how these restrictions are really affecting people's life right now. At the same time, we seem like we are a lot of hard time to finding the perfect indicators and the clear indicators for people to say where we at in this pandemic here in Manitoba. What would you have to say to people that, because we don't have any cases, like clear cases number, we have number of, like for the wastewater, for example, but we can't really rely on them that much. Do you maybe think of a clear indicator that you could maybe provide to people?
And so again, we've never had sort of one indicator that tells us everything. We continue to follow many of ours, and right now the most important indicators and has been for quite some time is that strain on the healthcare system. And so right now we're looking at our hospitalizations and ICU admissions, which seem to be stabilizing at this point. So again, it's very early to make any conclusions on that. But that is what we're seeing currently, and so we'll continue to follow that, and we'll have more to offer on the details of further restrictions in the near future.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. Furthermore, on the wastewater, you stated we saw a peak early in January, a decline a little bit later, and then sort of a plateau. But can you give us a little bit more actual quantification here? When you say at what average level would that later plateau be in relation to that peak earlier in January?
Yeah, and so it's a lot of variability there. So we are working on it so that this just be published and people can or would be able to see it. But what we saw is what would be reported as a peak, a high sort of watermark in early January. But since then, the numbers have been just fluctuating right around that mark. So we didn't really see a significant decline. And a lot of fluctuation of those numbers. So that's why it's it's one indicator. We're not able to rely on it because we're seeing a lot of fluctuation over time.
All right. Speaking of indicators, earlier this month, the province expanded its PCR testing capacity, hiring another lab. Yet we're not seeing testing numbers rise alongside that. In fact, we're testing fewer people than we did weeks and weeks ago. So knowing that, seeing that, why aren't you allowing more people to get PCR tests?
So I mean, the big reason is we were testing, for reason, and we're testing right now to ensure we have people diagnosed in a timely manner to receive treatment if they're eligible for that. So really we're shifting that over time. Where young, healthy people who have mild symptoms don't necessarily need to rush out and get tested. You can stay home and isolate. We want those tests available for people who are going to be eligible for treatment, so we can have a rapid turnaround of those tests. And right now that is meeting that demand.
From the Canadian Press, Steve.
Hi, Dr. Roussin. Just wondering about the BA2 variant. Is Manitoba seeing much of it, if any, and what's being done in terms of monitoring for it?
We haven't had this reported in Manitoba at this time. We still are sequencing, and at this point, that will have to be picked up by sequencing. Our screening wouldn't pick this up. So we still sequence in certain settings, and so we are looking for this variant in that respect.
Okay, and I just want to make sure I heard you right. You haven't seen a case yet in Manitoba, correct?
I haven't had this reported to me yet, no.
Okay, and you've been asked a lot of questions about possible changes to the public health orders. Are you still being supported by the government? Do you feel you're being listened to?
Yeah, public health works quite closely with government on this. So certainly we've always been at the table providing our advice, and have always felt that our advice has been listened to.
From CBC National News, Cameron.
Sorry, I had a little trouble unmuting there. Hi, Dr. Roussin. Just you were talking about indicators earlier. Looking at the ICU admissions, the hospital admissions. I suspect you're also looking at absenteeism in the healthcare system right now due to fatigue and infection within the system. Just wondering if any of this kind of highlights a basic level of strain that the system was even under before COVID. Is this highlighting basically a, I guess an inability to maintain a hard pace over the long term here?
So I think certainly the amount of transmission that's occurring is putting strain on the system, and then you add to that the absenteeism issue. So there is that additional strain to the system. As far as how this relates to to the overall capacity healthcare system, that's not going to be for me to comment on. That can direct that perhaps to Shared Health if they may have a comment on that.
Great, that's all my questions.
From La Liberté, Vincent.
Good afternoon. I have a request about the COVID-19 data that are being reported online on the website of the government of Manitoba. First of all, can you remind how the positive cases are currently being reported by the government of Manitoba?
So what makes up the numbers in those positive cases? So it is the positive lab-based PCR tests, and then there are certain sectors that are reporting positive rapid tests. So for the most part, the rapid tests that are done at home are not part of those numbers. And so the positive PCR tests done in a lab make up the largest proportion of those reported numbers.
Okay, my second question is related to the rapid test. As mentioned, Dr. Jazz at Wall on January 5th, the positive cases on rapid tests are mostly not being reported at the moment. Is that going to change?
No, that's not likely to change. Again, what we're testing for now is mostly for treatment. So we want people to be able to have access to testing, especially if they're high risk, to have a rapid turnaround on those tests, to be able to seek treatment within that relatively small treatment window. And so that's really the purpose of testing that we're shifting to. We still do PCR. We're still going to continue to do PCR because we need that to be able to sequence, because we still want to be able to do the surveillance in that manner. But the reporting of the home rapid tests are not likely to change.
From the Nipawa Banner and Press, Ken.
Hi, can you hear me now?
Go ahead.
Yes, thank you. Thank you for taking our questions. You've indicated, and other sources have indicated, that there is some protection from COVID-19 after having been infected. Do you foresee the day when people who have had COVID but who are not vaccinated may be allowed to attend venues, restaurants, and other currently restricted locations?
At this point, that's not that's something that's in the works right now. People who have been infected, we still want them to receive vaccination. We see a tremendous boost of their immune system when they receive a vaccine after they've recovered from infection. So we still want to encourage that. Right now, this is we still have plans to maintain that proof of vaccine concept for the time being.
And my follow-up question is after a person has had COVID, how long, and I've talked to a couple of different people in authority, but I would want to check with you what the official word is. How long should they wait after the COVID symptoms have passed before they get their vaccination?
So there's no hard and fast rule about how long people have to wait after an infection. What is critical is that they no longer be infectious. So certainly if people still have symptoms, we would ask them to wait and not come to one of the vaccine clinics until those symptoms have resolved. But after the symptoms have resolved, after they complete their period of isolation, they could come anytime after that to receive the vaccine. There was very early in the campaign advice to wait 3 months after an infection before going for a vaccine, but that was due to the short supply of vaccine that we had at that time. And so we wanted to provide the vaccine to people who had no immunity rather than providing it to people who had potentially some immunity because of an infection. That is no longer the case. We have adequate supply of mRNA vaccines, so we don't want people to wait 3 months between an infection and getting their next dose. So like I said, there's no hard and fast rule. Just make sure that you have recovered and don't wait months.
All right, folks, we have time for a few more questions. Please proceed.
Dr. Roussin, it's Bart Lakivas here. Forgive me, you didn't answer my second question. If we have more testing capacity now, why are we testing fewer people, about 2,000 a day, than we were weeks ago?
Well, a lot of that is based on the demand for that. So we want to have that PCR testing available for, like I said, for mostly high-risk people who we can offer treatment to. Many people are taking advantage of the rapid testing at home. And so a lot of that is just based on the demand, how many people are showing up for testing.
It doesn't match up with what people are saying, but completely different question. What proportion of our COVID deaths in the months of January have been Delta, and what have been Omicron?
Yeah, I don't have that in front of me. We can look at that. A lot of times it's difficult because that requires the sequencing of results. But we'll see if we have that broken down.
The reason I ask is we had rising Delta numbers when Omicron got here, and given the lag time, what's your theory on what percentage of the severe outcomes we're seeing are Delta versus Omicron?
Yeah, well, we certainly saw at the early stages of our Omicron wave that we did have that overlap of Delta. And so many of our clients in ICU remained Delta, especially at the beginning. We're starting to see that change over time. Again, I don't have the exact numbers of that in front of me, but certainly at the early stages of the Omicron, we did see a significant overlap with our Delta wave.
Dr. Reimer, it's Michelle from CTV. Earlier, you announced that you would want people who are older to get Moderna to save the Pfizer supply for the younger children. Do we have enough Pfizer supply for the second doses and potentially third doses for immunocompromised? Where are you at for supply?
So we do have enough Pfizer to provide to everyone under the age of 30 what the doses that they require, so long as we continue with our current approach. So even the allocation that we're getting in February would not be high enough that we can provide everybody who might want to have Pfizer at any age a Pfizer dose. But so far, with the number of people who have accepted a Moderna dose, despite potentially having Pfizer for dose 1 and dose 2, we have been able to maintain Pfizer for everybody under the age of 30. And if we stay at the same rate, we should be okay for February as well. But I want to make sure people who are over the age of 30 still continue to accept Moderna, because we do need to maintain having many people, most people, switching to Moderna who had previously received Pfizer.
Dr. Roussin, you talked about the change to contact tracing requirements for daycares and the fact that that hasn't been effective. Are we going to see contact tracing in Manitoba ever return to previous levels, or is this a winding down of the public health response?
So, like anything, it really is going to depend on what the virus gives us. So, with Omicron, so infectious, very short incubation period, it's not conducive to contact tracing. Certainly not in the manner in which we had been doing it. If we see a change in the virus again, then it's perhaps there may be a need for it. So right now we're dealing with Omicron. and the nature of this virus is not conducive to widespread contact tracing.
Just to follow up to that, Dr. Roussin, I'm sure this change will likely worry some parents, especially those who are maybe sending children too young to be vaccinated to these facilities. What would you say to them? Because for a long time we relied on pretty extensive contact tracing, and now this is winding down. Is there anything you would say to them to kind of quell those concerns as this change takes effect on Friday?
So I think again, reiterating that. Certainly on average, this virus has been much less severe in the younger ages. So we just don't see that severe outcomes very commonly in the young children. We know that the case and contact management is just not effective. So it's not really a matter of scaling it back. It's just it's not going to be effective even if we try to do it. And then again, we've seen that toll on having kids out of school, out of daycare, that toll on kids and on parents. And this is a manner of trying to reduce some of that burden. So I think it's a prudent move, and it's overall the level of severity in the young children is so low. And I think that this is our pragmatic move forward.
I know a lot of people, parents and experts alike, are concerned about the effects of long COVID in children. And I know, Dr. Reimer, you mentioned that most of the data has to do with adults so far. I think the lack of data in some of those younger age groups is concerning people. How much does that weigh into these decisions when you are dealing with some relative unknowns as far as young people go?
Yeah, and so we're looking at the overall health impacts, and so we know that certainly COVID has had a significant impact on the health of many Manitobans, but we know there's so much more to health than COVID, and there's so much benefit of having these kids in school, in care, and so we're trying to weigh all of those factors, and we know that certainly on average, the risk of severe outcome is much lower in the younger kids.
Time for a couple more.
Dr. Roussin, how fair would you think it is to say that Manitoba's pandemic management response for the past month can be characterized as really leaving the most vulnerable people out to dry here, given the fact that the people who are disabled, people who don't have access to vaccines, and those are the working poor, despite all efforts, excellent experts by Dr. Reimer, and the immunocompromised and the elderly, how fair would it be when you hear people say that Manitoba has sort of practiced a policy that is letting those people bear the brunt of this?
Well, I think we moved quite early on restrictions. So, I mean, to answer your question, I don't think that's fair in any way. Manitoba moved quite early on, on restrictions related to a pending Omicron wave, and really things like case and contact management are just not effective. So that wasn't leaving anyone else out there, just that it wasn't going to be an effective approach to this variant. And then certainly, like you mentioned, vaccines have been available. There's been a tremendous amount of work and a tremendous uptake by Manitobans on that. And we still had many other tools in our repertoire against this virus. So certainly there's restrictions in place, and we responded to Omicron.
You have restrictions in place, but to be fair, if you look at Quebec and Ontario, and Quebec having, the worst Omicron wave and the highest death rate, but Manitoba having the highest hospitalization rate. If you look at Quebec and Ontario, they really did go further than us. What do you make of that?
Yeah, I think that there's been a varied response and varied timing throughout much of the pandemic related to, local factors. You mentioned those provinces and compare it, but compare it to Western provinces, we have been more strict in many aspects. So there's lots of variability out there, and then now we see that those provinces are moving to loosen restrictions as well, and so it's really hard to compare across provinces with different timing, with different settings.
Do you feel your current personal pandemic management philosophy has been challenged by the existing political leadership?
I mean, I don't know about the fairness of that question, right? Public health receives input from many settings. We have many public health experts, epidemiologists that provide a variety of inputs, and there's a lot of variability on those recommendations that come to me. And then I work with many stakeholders, including government, to try to provide the best advice moving forward. And so it's a challenging time, and it's really hard to break down the success of everyone's response simply based on the strictness of the restrictions. So it certainly has been a challenging time.
Any other questions? One last question.
Hi, Taylor Brock here.
Hi. Oh.
What's being done right now to track and treat long haul symptoms?
So at this point, that's not something that's reportable to public health. It's not a reportable illness. So public health doesn't receive regular reports on that. There are acute care providers that are operating clinics in that regard, but public health doesn't receive this as a reportable illness.
It's Michelle from CTV. I'm wondering if the way we report cases generally, like we get them daily and then over the weekend, would that potentially change as well?
Again, as we look at our overall response, as we're starting to move forward with this, our overall response to Omicron, things like that may change. We'll certainly provide details if we have any plans to do so. So right now, we don't have anything immediately pending in that regard.
Dr. Roussin, Dr. Reimer, concerning the use of rapid tests, how many positive cases do you estimate are not being reported in Manitoba due to the use of rapid tests?
This is really hard to say. It's when we look at things in the past, we would see that even in our other waves after seroprevalence studies, we saw that maybe we were diagnosing 1 in 4 cases. Certainly, with Omicron being so much more widespread, so much more infectious, it's it's a multiple of that. But it's tough to pinpoint what that would be.
Thank you, doctors. Thank you, everyone. This concludes our Zoom session.